Senator Ron Johnson of Wisconsin, who, of course, is one of the big four co-sponsors, whose name is on the new health care bill that is attempting to repeal Obamacare. Senator Johnson, welcome back to the show, sir.
Well, Chuck, how you doing?
I'm okay. Let me start with a larger funding question. Why did you decide, in coming up with your funding calculations for this bill, to basically take all the money that for the states that did expand Medicaid and put it in the same pot for states that didn't expand Medicaid? Why not make the uber first number the equivalent of what would have happened if all 50 states had expanded Medicaid, and start your block grant process from that number?
Well, I would start from the premise that we're $20 trillion in debt. Over the next 30 years, CBO projects at least another $100 trillion of deficit spending. So we're already mortgaging our kids' future. And really what I think the main premise would be is right now federal funding on health care is grossly unfair. You have three states, California, New York, and Massachusetts, represent a little more than 20% of the population. They get 36% of Obamacare funding. It's just simply unfair. So,
but do you know why that is?
That'd be one of the first premises when you spread that
Senator,
around.
There's a simple explanation for why that is. Those three states chose to participate in the program. Had the states of Texas and Florida, had the states of Texas and Florida done that, that percentage you just rattled off to me, the unfairness blamed the Republican governors.
But Chuck, we're $20 trillion in debt. Hey, Chuck, do you have any kids?
Of course.
Are you concerned about their future? Are you concerned about the fact that they're mortgaging our kids' future? $20 trillion in debt. More than $120 trillion in the next 30 years.
I understand the fiscal.
Obamacare
exacerbated
that problem. All this out-of-control spending is exacerbating the problem. So that's one of the first things we have to do is we have to begin putting some kind of control over the out-of-control entitlement programs. Medicaid, Obamacare is one of those. And, of course, Obamacare expanded Medicaid to able-bodied, working-age, childless adults, putting at risk Medicaid for disabled, elderly, and children. You know, Obamacare funded Medicaid for, again, able-bodied, working-age, childless adults at 100% versus normal Medicaid for the disabled, somewhere around 60%. So I'm concerned about the disabled, children, the elderly, whose Medicaid is put at risk by the expansion of Medicaid to able-bodied, working-age, childless adults.
But this ended up pitting states against states. So what you have now is New York, Matt, what you just said, New York, Massachusetts.
Obamacare pitted states against states.
So New York,
36% of funding went to three states. Senator, that's not fair, Chuck.
What they chose to expand it, they would look at it as, wait a minute, we participated in a federal program. Look, you may not like it, but it was a federal program that was approved. And now you're taking away those resources from programs that they designed. Well, and you're doing it on a partisan basis. So why does two wrongs make a right?
We had responsible states, responsible governors that realized that Medicaid in general was unsustainable. So the last thing you want to do is throw another entitlement on top of an already unsustainable program. So you had responsible governors like Governor Walker, who didn't take Medicaid expansion, realizing that the trough was eventually going to dry up. And that's true. And so they didn't. What the last thing you want to do is ladle on top another entitlement. And so what Governor Walker did instead, didn't get credit for it, was the only governor using innovative techniques to close the coverage gap under Obamacare for people making less than 100% of the poverty level. That's what state innovation can do. And that's really what Graham-Cassidy-Heller-Johnson does. We take this basically the same amount of funding over the next 10 years under Obamacare, but rather than have a one-size-fits-all model that is grossly distributed in a very grossly unfair way, we distribute that fairly to the states so they can innovate. Things like Maine's invisible high-risk pool. You know, they instituted guaranteed issue, which is one of the primary drivers of these premiums that have been artificially increased. They took that guaranteed issue, didn't repeal it. They supplanted it with an invisible high-risk pool. Premiums were cut to a third of what they were for young people, about a half to old guys like myself. So there's actually things you can do, even within the constraints of the market distortions of Obamacare, but the states have got to be given the flexibility to do so.
Totally get the federal government using money to incentivize or using innovation to incentivize. I get that part of it. Let me ask you about another part of the bill.
And mortgaging our kids' future.
Because of the pre-existing condition issue. This is what is written in your bill. And it said this: a state can request a waiver right, when they put together their program on the essential benefits and things like that, a waiver on the regulations. If the state intends to maintain access to adequate and affordable health insurance coverage for individuals with pre-existing conditions. That is the lone sentence in there on this. My question to you is, how do you legally enforce that? What is the metric that you're going to judge whether a state is providing adequate and affordable health insurance coverage for individuals with pre-existing conditions? What is the metric?
Well, Chuck,
the accountability?
first of all, you're fully aware that on the Senate reconciliation rules, we can't repeal guaranteed issues, so that remains the law of the land. And also, do you really think that a faceless bureaucrat in Washington, D.C. is more concerned about the citizens of Wisconsin than state and local officials? Now, I just completely reject the premise that state and local officials aren't going to care about the people in their state. You know, I'm the guy that's been trying to protect the forgotten men and women of Obamacare, the folks that Bill Clinton talked about. They're busting, you know what, they're busting it out there, working 60 hours a week. Their premiums have doubled, in many cases tripled and more. Coverage cut in half. They don't get subsidies. They can't afford care because of the market distortions of Obamacare. States will understand that. They'll show far more compassion to those forgotten men and women. No compassion has been shown to them by Democrats in Obamacare. And they'll actually innovate to try and bring premiums down like Maine did with their invisible high-risk pool. You can do this, but not with a one-size-fits-all model in Washington, D.C. with Obamacare.
Senator, I totally believe you that you're committed to doing that, but you didn't tell me what's the accountability here? How do you, a state can intend, there's nothing in the word intend that guarantees anything. I understand that you believe that a state
remains
would do
the
it.
law of the land.
But explain to me how you enforce this and who decides what is affordable and adequate. You know, one person can say, well, I've got a $30,000 deductible.
Who decided under Obamacare? Who decided under Obamacare? Is care affordable? Premiums nationally have doubled under Obamacare, tripled in many cases. People are paying the fines.
Senator, I understand
100,000 people are paying the fine. 82% of them make less than $50,000. So Obamacare isn't working, Chuck.
I'm not asking about Obamacare, Senator.
I have greater faith. I have greater faith in state and local officials caring about their individuals. They're going to be compassionate, Chuck. And what your premise is they won't be.
No, but it's called
good.
trust but
then we don't have a problem here.
Senator, but as you know, if you don't write it into the law, it doesn't always get followed, sir. I mean, we've been through this.
Chuck, what is Obamacare called? Patient Protection Affordable Care Act. Millions lost their insurance. We've got people, again, the forgotten men and women can't afford insurance. I mean, just because you write in the law doesn't make it so. Obamacare is a failure. People can't afford it. The markets are collapsing.
Senator.
I've got greater faith in 50 states managing that money more efficiently, more effectively, more accountably than Washington, D.C.
I understand.
You believe the federal governments can actually do this? I don't.
Honestly, I don't know. I'm here asking you this question, though, which is, how does this sentence,
50 states,
and I'm just saying, is there any way to, what is the accountability to make sure that the 50 states, however they do this, provide access to adequate and affordable health insurance coverage for those folks with pre-existing conditions? What is the metric? Who decides this? The
guarantee are the elected officials are going to be responsible to their citizens. Local and state government is far more accountable than faceless bureaucrats in Washington, D.C. So the control is the electorate. The only guarantee in this process
is the fact, guarantee of pre-existing conditions.
If we don't do anything, premiums will continue to rise, markets will continue to collapse, and Obamacare continues to be unworkable. There's 100% guarantee on that. I have greater faith in state and local officials showing the compassion, not forgetting about the forgotten men and women of Obamacare. I just have more faith in state and local governments. I realize maybe you don't, and certainly Democrats don't, but the proof is in the pudding. Obamacare has failed. It's failing individuals. There have been real harm and damage done by Obamacare. So I'd rather turn it over to the states. Makes a whole lot more sense. And by the way,
I understand
federal funding will be distributed far more fairly.
Is there any mechanism here that guarantees the protection on pre-existing conditions, because this sentence, as written,
yes,
is not a guarantee.
It's
a promise. It's not a guarantee.
It's the law of the land. It's the law of the land. That's not being changed.
Intend is not a promise.
Chuck,
Intend is simply a promise.
We're not repealing guaranteed issue. Guaranteed issue is not being repealed. And the only waivers that language refers to states getting grants on waivers on the other market distortions. Some of the essential health and benefits, which, by the way, Obamacare also had 1332 waivers. They just never granted them to the states, by and large. And so the one size fits all model failed. So
you contend that this bill will protect those folks with pre-existing conditions, period.
Every bit as well as Obamacare did, and it's also going to protect individuals that can't afford Obamacare right now. You're going to have the state innovation. Again, you take a look at best practices like Maine's invisible high-risk pool. Didn't repeal guaranteed issue. We're not repealing guaranteed issue, but lowered premiums dramatically.
All right, Senator Johnson, I'm going to leave it there. I hate when we do this satellite conversation because I know we're just having a good conversation, but people think it's something else. Anyway, it's always a pleasure to have you on, sir. I appreciate it.
I'll come in studio next time and we can duke it out there.
We will do that. Always enjoy it. Thank you, sir.
Have a good day.